Alright, this is Amir.
And this is Kevin. And we made a video because we're novel,
Creative.
complete.
And we never took public speaking courses. Today we're going to talk about Kawasaki disease. Do you know what that is, Amir?
Let me think about that. Okay,
Yes.
let me split it up. Kawasaki, right?
Right.
Sounds Japanese.
Yes.
Like the motorcycle.
Right.
And disease. That means unhealthy, unwell, sick, like a sick child.
Maybe.
So if we combine them together, the only logical conclusion is...
You're an idiot. Kawasaki disease was first described in Japan by Dr. Tomosaku Kawasaki in 1967. The disease affects 19 out of every 100,000 kids in the United States and is most common among children of Asian descent, but can affect other ethnic groups as well. It usually targets kids mostly under the age of 5 years or younger. The causes of Kawasaki disease are unknown, but scientists suggest immunological causes. Doctors cannot use specific laboratory tests to target the condition, and it can only be determined clinically through the symptoms. It shares similar symptoms with other serious diseases such as scarlet fever or toxic shock, and children with Kawasaki disease are not diagnosed until visiting many different healthcare providers, which makes it difficult to respond. Symptoms include bloodshot eyes, high fevers, bright red chapped lips, red mucous membranes in the mouth, peeling skin, strawberry tongue, red bumps on the back of the tongue, swollen lymph nodes, sore throat, skin rashes in the middle of the body, and red palms and soles of feet. So if your child looks like this,
oh yeah!
It probably has Kawasaki disease.
So what does this have to do with our course?
I don't know. You tell me.
I'll show you.
Whoa, what's that silly thing, Amir?
That's a heart, and it pumps blood all around the body.
But then how does the heart get blood?
Oxygenated blood is pumped to the heart via the coronary arteries. Since the heart is continuously operating, it needs a continuous supply of oxygen and nutrients. Let's take a closer look. The wall of these arteries become inflamed in people who have Kawasaki disease. Usually the endothelium protects the wall, but an unknown event causes the endothelial cells to become activated and starts attracting cells of the immune system. These cells attach to the endothelium and squeeze past the other cells. Then they release inflammatory signals that attract more immune cells, which cause even more damage to the cell walls of the vessel.
That sounds dangerous.
Don't worry, if the child receives gamma-globulin or IVIG within the first 10 days after fever onset, it is almost certain that the child's artery will return to normal.
But what if they catch it too late?
If IVIG is ineffective, the coronary artery will dilate or widen. This dilation results in a ballooning of the artery, which is also known as an aneurysm. This ballooning of the vessel causes the blood to swirl around, which increases the risk of blood clot formation. If the blood clot grows any larger, this might lead to a blockage of the vessel and even a heart attack. If a clot does not occur, scar tissue will begin to form in the aneurysm, causing the vessel to return to normal width. However, the scar remains for several years after the initial unstruck. The scarring could grow and decrease the width of the vessel and cause another heart attack. About 2% of patients pass away as a result of Kawasaki disease, and most living victims are more susceptible to coronal stenosis, which leads to heart attack.
So as you can see, the aneurysm caused by Kawasaki disease has many biomechanical properties. The coronary artery can be modeled as a cylindrical tube, and the abnormal pressurization and internal stresses within the tube can be examined. Before scarring occurs, as seen before, fluid mechanics comes into play. Normal blood flow throughout the circulatory system is laminar, but in the case of a coronal aneurysm, the flow becomes turbulent. All these properties can be studied for the purposes of figuring out causes for Kawasaki disease and treatments, and just for general knowledge of the disease.
How are we doing on time?
Sweet. Stay classy, Berkeley.
And we're out.